National Advisory Eye Council, 6700B Rockledge Drive, NEI, NIH, October 12, 2018. Collaborative Clinical Research Portfolio, Sangeeta Bhargava, Ph.D. Slide, NEI Clinical Research. Collaborative Clinical Research, Division of Extramural Science Programs.
What I'm going to do today is give you a brief overview of the NEI Clinical Research. I am the sole representative today of my program here. My other two distinguished and esteemed colleagues, Don Everett and Mary Ann Redford, have conflicts, and they are attending DSMC meetings for their respective trials. The DSMC meetings are an integral part of our job, and we do it on a regular basis as an NEI representative to give the right amount of oversight. So in the past few council rounds, you have heard a lot of basic program.
Slide, NEI Extramural Program Matrix. Matrix diagram showing programs of genetics, infection, inflammation, and immunology, collaborative clinical research, small business, ocular pain, myopia and refractive error, and training. Collaborative clinical research is highlighted. These programs intersect with basic programs for retina, cornea, lens, glaucoma, SAVP, and low vision.
Concerning the retina, the cornea, the lens, the glaucoma, and the low vision. And what I want to emphasize in this extramural program matrix, that the collaborative clinical research program crosses over all of them. So that means we have clinical studies as well as trials from all these areas, which is the retina, cornea, lens, glaucoma, and low vision. Our main goals of our
slide, Collaborative Clinical Research, or CCR,
clinical research program is to test new agents, technologies, and other interventions for the prevention, diagnosis, or treatment of eye diseases, and our improved vision-related quality of life. We fund applications that conduct population-based research to describe the prevalence of eye diseases across the lifespan and within and among divergent demographic groups. We have applications that conduct studies to identify risk factors for the development, persistence, and progression of eye diseases, and applications that do secondary data analysis using existing database resources. We also have a lot of grants in our portfolio which look at to conduct system-level health service research to improve vision health and or reduce health disparities. And we also have applications that are looking to develop new statistical methodology or tools appropriate for analyzing vision health data. And lastly, applications that develop new approaches to conducting clinical research studies, including those that capitalize on point of care, as well as the electronic medical records. So the way we do our clinical trials
slide, CCR Funding Mechanisms,
is through two mechanisms. One is the cooperative agreements, and earlier in the morning you have heard of U01s and U24s. The activity code that we use in the clinical trials is the UG1. And these are for our bigger trials. And I just want to remind the council members that the cooperative agreement is a support mechanism that the NIH frequently uses for high priority research areas that require a lot of involvement from NIH staff, which is much more than what a typical research project or an R grant would be. We also do clinical studies and some of the epidemiology studies using the R mechanisms, and these are for our simpler clinical and epi studies using the R01. We have the secondary data analysis, which we use the R21, and this is one of our more popular program in our portfolio.
Exploratory Development, R21.
We also do a lot of clinical study planning grants, and those are the R34 grants. So in the next couple of slides, what I'm going to show you is a few examples of our clinical trials and epi studies that we have done over time. But I also want to remind the council members that before we do any study or we start any clinical trial or epi, we always bring it to the council for their discussion, for their input before any trial is started. So some of our epi studies, and these are just examples, just to give you a flavor of kind of studies we have done over time.
Slide. CCR Epidemiology Studies. Examples. AACDAT, Amblyopia and Astigmatism in Native American Children, Development and Treatment, Astigmatism and Amblyopia. ADAGES, African Descent and Glaucoma Evaluation Study, Ancestry and Glaucoma. AFEDS, African American Eye Disease Study. BDES-5, Beaver Dam Eye Study 5, Cohort Study, 20-year progression AMD, Pool 3 studies for AMD candidate genes. CHES, Chinese Health Eye Study. CLEERE, Collaborative Longitudinal Evaluation of Ethnicity and Refractive Error, Ethnicity and Refractive Error Development. CLEK, Collaborative Longitudinal Evaluation of Keratoconus Ocular Development in Infancy/Early Childhood. Cochrane Collaboration, Vision Systematic Reviews. COSMICC, Collaborative Observational Study of Myopia in COMET Children, Longitudinal Myopia Study. LALES, Los Angeles Latino Eye Study. LSOCA, Longitudinal Studies of Ocular Complications of AIDS, Cohort Study, CMV Retinitis. MEPEDS, Multi-Ethnic Pediatric Eye Study, Prevalence Survey, Amblyopia, Strabismus, Refractive Error. MUSTFUS, Uveitis Follow-Up Study. WBM, Web-Based Methods, Visual Testing Development for Trials. VIP, Vision in Preschoolers, Vision Screening, Tests and Testers.
We have done a glaucoma evaluation studies for the African descent. We've done for a demographic population, we've done the CHESS study, the Chinese Health Eye Study. We've done the Latino eye study. We have looked at some of the infectious diseases. We have done for the AIDS complication, the ELSOCA study. We have done for an uveitis. We've done the uveitis follow-up study. We've also looked into studies, epi studies in children, and that has been the VIP study or the AACDAT study. So we've done quite a few studies, and this is just to give you a flavor of some of the epi studies we've done. Besides the epi studies, we've also looked into the clinical trials.
Slide. CCR Clinical Trials. Examples. ASANTE, a surveillance and azithromycin treatment for newcomers and travelers evaluation. BLINK, bifocal lenses in nearsighted kids. CALEC, cultivated autologous limbal epithelial cell, or CALEC, transplantation in the treatment of limbal stem cell deficiency. CATT, comparison of AMD treatment trials, Lucentis versus Avastin. CITT, Convergence Insufficiency Treatment Trial, Vision Therapy for CI. CLAMP, Contact Lenses plus Myopia Progression Study, Rigid Contact Lenses, Myopia. COMET, Correction of Myopia Treatment Trial, Single Vision versus PALs. CPTS, Corneal Preservation Time Study, Tissue 7 versus 14 day. ETROP, Early Treatment of ROP, Early versus Conventional Treatment for ROP. EROP, Telemedicine Approaches to Evaluate Acute Phase ROP, RETCAM versus Gold Standard. FAST, First-Line Anti-Metabolites as Steroid-Sparing Treatment Uveitis. IATS, Infant Aphakia Treatment Study, Congenital Cataract, Contact Lenses versus IOL.
And these are, again, some examples of clinical trials. We have looked into clinical trials using interventions, some that target the vision diseases. For example, the CAT study, which was to target the AMD. We have the SCORE2, which was to do the retinal vein occlusion. We have studies ongoing that are looking at some of the infectious diseases like the herpes zoster. We have disease trials going on in the uveitis field. The metamust is one of them. We have studies that we have done for early treatment of ROP, the ET-ROP as well as the EROP. We have studies done for uveitis, as I mentioned, one of them is the FAST.
Slide. CCR Clinical Trials. Examples continued. LCA. Labor congenital amaurosis. Gene therapy for LCA. LHON. Gene therapy for Leber's hereditary optic neuropathy. MUST. Multicentered uveitis steroid treatment trial. Implant/systemic therapy. MUTT. Mycotic ulcers treatment trials. Mycotic ulcers. Natamycin versus voriconazole. Oral voriconazole. OHTS. Ocular hypertension treatment trial. Ocular hypertension. IOP. Lowering medical treatment versus placebo. SCORE2. Comparative treatments for retinal vein occlusion. SCUT. Steroids for corneal ulcers trial. Bacterial corneal ulcers. Topical corticosteroids. SWIFT. Sanitation, water, and instruction in face washing for trachoma. TANA. Trachoma in Amhara, Ethiopia. Trachoma treatment. Antibiotic. TRUST. Intravitreal autologous bone marrow CD34 positive stem cell therapy for retinal vein occlusion. VIEW. Community health intervention to prevent corneal ulcers. CEDS. Zoster eye disease study.
And what I really want to bring out that as the research in basic research is moving along, as the advances in basic research come along, we also have more clinical trials in that area. So for example, we just recently funded some clinical trials using stem cell therapy as well as gene therapy. And those are examples, the LAWN study, the TRUST, as well as the CALEX study. Earlier in the morning,
Slide. CCR networks.
Dr. Sieving alluded to the networks. And these are one of our success stories in our portfolio of the CCR networks. We have two networks that we have been involved with in the past few years. One of them is the PDIC, that is the Pediatric Eye Diseases Investor Group, and the other one,
drcr.net,
is the Diabetic Retinopathy Clinical Research Network Group. One thing Dr. Sieving also alluded in the morning session, the difference between a network as well as the clinical trials and epi studies that I just showed you before. The trial is basically one protocol, but with the networks, because they have so many clinical sites involved, so many physicians involved, they are doing multiple protocols at one time. A couple of things that I want to point out about our networks is one that, which is very unique across the NIH, is one that they are open network. That means pretty much anyone can join in to do a protocol. They can do two protocols if they want to do, or if they don't want to do a protocol, they don't need to do it. And as Dr. Sieving earlier also pointed out, that most of the physicians or the participating sites are 3/4 community-based providers and 1/4 is academic institution. Both the networks have been an example of private-public partnership. And last but not the least, I want to point out that they have been very collaborative and in terms of the other NIH institutes. We do collaborate with the National Institute of Child Health and Human Diseases, NICHD, for the PDIC. And for DRCRN, there is ongoing collaboration with NIDDK, as well as co-funding by the same institute. Thank you.
Logo for NIH, National Eye Institute.